What is an ectopic pregnancy? What is the first sign of an ectopic pregnancy? In this video today, we are going to talk about an ectopic pregnancy. Mu video yaffe ya leero tugenda kwogera ku kye bayita ectopic pregnancy. Kiki ekitegeeza bwe tuba tugamba nti ectopic pregnancy? After this short break, we are talking about an ectopic pregnancy. Stay around. Thank you for sticking around. We are talking about what is the first sign of an ectopic pregnancy, and we are discussing everything about ectopic pregnancy. I welcome you to our channel, Gerard Master, the health educator. If it's your first time on our channel, on this channel we do create awareness about fertility and reproductive health. So when we are talking about an ectopic pregnancy, ideally a female pregnancy, or when a woman gets pregnant, the fertilized egg is supposed to grow inside the uterus. The growing baby is supposed to grow inside your uterus. But if we have fertilization taking place, you are now confirmed that you are pregnant, but the baby, Thank you for sticking around. We are talking about what is the first sign of an ectopic pregnancy, and we are discussing everything about ectopic pregnancy. I welcome you to our channel, Gerard Master, the health educator. If it's your first time on our channel, on this channel we do create awareness about fertility and reproductive health. So when we are talking about an ectopic pregnancy, ideally a female pregnancy, or when a woman gets pregnant, the fertilized egg is supposed to grow inside the uterus. The growing baby is supposed to grow inside your uterus. But if we have fertilization taking place, you are now confirmed that you are pregnant, but the baby, the growing fetus, the growing baby, instead of growing inside the uterus, grows outside the uterus, then we say there's a problem. When a growing baby grows outside the uterus, inside instead of inside your uterus, then we say there's an issue. When a growing fetus is growing inside the uterus, we call this an intrauterine pregnancy. Whereas when the growing fetus is growing outside your womb, we call this an ectopic pregnancy or an extrauterine pregnancy. Now, normally an ectopic pregnancy develops between 4 weeks and 14 weeks. That is roughly, if you are pregnant and the pregnancy is at least 1 month, it will not go into the second month without you noticing changes happening in yourself. Actually, you'll begin noticing changes like, we are going to talk about the signs and symptoms of an ectopic pregnancy, but what we want to know is that an ectopic pregnancy develops between the first month and the second month. That is roughly 4 weeks up to the 12th week. So when an ectopic pregnancy is developing, there are going to be changes that are happening. Tuligamba mu video yaffe eno nti ectopic pregnancy kiba kitegeeza olubuto oluli okukula wabweru wa nabaana mu kifo ky'okuba nga luli kukula munda mu nabaana. Ideally omukyala waba afunye olubuto lulina okuba nga lukulira munda mu nabaana. We luba lukulidde wabweru wa nabaana, tuba tugamba nti eyo gye tuyita ectopic pregnancy. So we've talked about an ectopic pregnancy. We now know that an ectopic pregnancy is a type of pregnancy whereby the baby does not grow inside your womb, the baby grows outside your womb. What are the common sites for an ectopic pregnancy? We've talked about an ectopic pregnancy, we now know what it means, but what are those common sites where this ectopic pregnancy will occur? When we take a look at the female reproductive system, an ectopic pregnancy normally develops in the fallopian tubes or in your tubes. We call them the fallopian tubes because they are specifically tubes which are designed to carry a fertilized egg up to your womb where it attaches itself and then it grows. So when we take a look at the male sperm, when it travels through the fallopian tubes, it is going to actually attach itself onto the egg, and then fertilization will take place. Then this fertilized egg will be moved by cilia. These are hair-like structures which will move this egg backwards up to your womb, where it will attach. When a woman has issues, in her tubes, maybe she has a history of chronic infections or chronic UTIs, and then she's exposed or she's predisposed to free fluid accumulating in her fallopian tubes, or even when a woman has a history of tissue growing in her fallopian tube, we call this adhesions, then she's actually going to be at high risk of developing what we call an ectopic pregnancy. Remember to subscribe so that you do not miss new videos we release every day. On this channel, we do talk about fertility and we do create awareness about reproductive health. So the first place where an ectopic pregnancy is going to grow is in the fallopian tube. The fallopian tubes are the first area where the ectopic pregnancy is most likely going to grow. The next site for an ectopic pregnancy is around your ovaries. Fertilization can take place, but instead of the fertilized egg moving backwards up to your womb where it's going to attach itself, the fertilized egg remains in the ovary, then it begins growing into a baby. We call this an extrauterine pregnancy or an ectopic pregnancy. So the first site for an ectopic pregnancy, we said it is inside your fallopian tubes. The second site, the second place where the ectopic pregnancy is going to grow is in your ovary. The third site where the ectopic pregnancy is most likely going to grow is actually going to be what we call in your abdomen. An ectopic pregnancy can decide to develop in your abdomen. Things can happen and actually this may not be really good. So what are the signs? How can you tell that you are having an ectopic pregnancy? You've done the pregnancy test and the results are showing a positive pregnancy test. Maybe you did the test of urine, or you did the serum HCG pregnancy test, and then it confirms that you are pregnant. When the pregnancy is developing, many things are going to take place. So the first sign of an ectopic pregnancy is vaginal bleeding. Vaginal bleeding is the first sign of an ectopic pregnancy. When you are pregnant and you experience bleeding, which may be watery and it may actually be light bleeding, we call this a danger sign and you should see your doctor immediately. So if you are pregnant and you experience vaginal bleeding, then it's high time you see your doctor. This could be an ectopic pregnancy. Excuse me. The next sign of an ectopic pregnancy is abdominal pain or tummy pain. When you are pregnant and you are experiencing abdominal pain, then there are high chances that you could be having an ectopic pregnancy. We are saying that the first sign of an ectopic pregnancy is vaginal bleeding. Vaginal bleeding, we've talked about this. When you are pregnant and you experience vaginal bleeding, then it's high time you see your doctor so that some tests may be done on you to confirm what could be causing this bleeding. Ectopic pregnancy, sign number 2. Abdominal pain, we've talked about this. If you are pregnant and you experience pain and this pain is one-sided, maybe it is on your left side or it's on your right side, then it's high time you see your doctor so that some tests can be done on you to confirm what could be causing this pain. Next sign of an ectopic pregnancy is shoulder tip pain. If you are pregnant and you are experiencing in the first week or in the second week or even in the first month and you are experiencing pain around the tip of your shoulder, then this is another sign of an ectopic pregnancy. But still, you have to see your doctor. who will do some tests on you to confirm that really this could be an ectopic pregnancy. And then, by the way, as a point of information, you could be having shoulder tip pain, and this could also indicate other issues. So you need to see your doctor to rule out that this could be an ectopic pregnancy, because shoulder tip pain could be connected with other things. For example, cardiovascular disorders like heart disease. So you should always see your doctor so that some tests will be done on you. Next sign of an ectopic pregnancy is you could actually get discomfort going to the toilet. When you are pregnant in the first trimester and you have discomfort going to the toilet, much as this could indicate something else, but you need to have yourself get checked out, it could be a sign of an ectopic pregnancy. And then also, if you begin feeling dizzy, you begin feeling sick looking, and then you look pale, yes, these are actually among the early signs of pregnancy due to a hormone known as progesterone. We can actually say that this is okay, but still it can be managed if it increases. But still, if you feel dizzy, sick looking, and you become severely sick, the pains are there, you are having vaginal bleeding, then you should not remain at home. You should go to hospital and get yourself checked out. So tubadde tuligamba nti signs ezisooka eza ectopic pregnancy oba olubuto olw'omunseke, tugambye nti sign esooka yeyokuba nti ojja kuba olaba omusaayi nga gufuluma, tukiyita vaginal bleeding. Ekirala tugambye nti oba oli lubuto mu mwezi ogusooka naye n'oba nga kuwulira nga olubuto lukuluma nnyo ate lukulumira side emu, one sided pain, then tuba tugamba nti wandiba ng'olina kye tuyita ectopic pregnancy. Ekirala tugambye nti oba olina olubuto oli mu mwezi ogusooka naye woba ng'oli kugenda mu tooyi naye nga okola lonko n'olaba nga olikuwulira obulumi bungi nnyo, era nakyo kisobola okulaga nti wandiba ng'olina ectopic pregnancy. Thank you, my friend. We are proceeding with what are the tests that can be done to confirm that you have an ectopic pregnancy. The first investigation or the first test which will be done to confirm that you could be having an ectopic pregnancy is your doctor will request for a pelvic ultrasound scan. A pelvic ultrasound scan is a checkup which is done in hospital where some liquid, some gel will be applied on your abdomen. It's not a painful procedure. You should not have any worries. And then after applying this gel, there's something called a probe. Your doctor will get this and then begin actually applying some gentle pressure while checking your abdomen, checking your pregnancy, and then images or pictures will be displayed on the screen of an ultrasound scan machine, and then your doctor will do the interpretation. Your doctor will pay close attention, first of all, to what we call the bladder. The bladder is an acoustic window, but in simple terms, the bladder contains water. It contains free fluid, that is urine, and this urine helps or it aids the doctor to be able to see other structures. Water acts as a medium to help the doctor see other structures. So, your doctor will first take a closer look at your bladder, and then your doctor will move on and look at your uterus. Ideally, the uterus is in an antero-posterior position. In simple language, your uterus is actually next to your bladder, your urinary bladder. So, when the doctor is doing the ultrasound scan checkup on you, your doctor will pay close attention to your uterus, and then he or she will examine your uterus and then look for signs of pregnancy. This could be the decidual change